Hi, my name is Irfan. I work for Pharmacy Prep under the direction of Dr. Misbah Biabani. In this clip, I'm going to be speaking a little about the interactive stations in regards to the over-the-counter station. Because as I said in my earlier clips, that the interactive stations are further broken down into a few, and one of them, the important one, is the over-the-counter station or OTC station. So in this station, pretty much like the remaining interactive stations, you have to introduce yourself, offer the patient confidentiality, and depending on what patient is saying, you have to offer empathy. Like patient is, if you see that the patient is in pain, so you have to offer empathy, like saying sentences like, "It must be a little hard for you. I'll try my level best to help you over this." And try to avoid statements like, "Oh, I'm so sorry. I feel sorry." So there could be a likelihood that the patient might say, "You have no reason to be sorry." So in my personal perspective, the statements which comprises words like sorry would probably not be taken very appropriately and positively by the patients. So by just stating, "It must be a little hard for you," to me was the best statement. So coming forward, mostly the over-the-counter stations, there's a lot of questioning in that. Because a patient in this particular case, in this particular station, is coming for a recommendation by the pharmacist. And in the over-the-counter, as you know, that it's not the doctor's call. So if you ask certain questions like, "Could you explain a little about your symptoms?" Because the patient is coming for your recommendation in regards to a particular situation that the patient is experiencing. There could be so many things. And the best thing for that is the CTMA, the minor ailment part, which you all should have a very good grasp on. So in this regard, you always ask when a patient is coming that, "Could you please elaborate a little about your situation or symptoms?" Then the patient, depending on the answer, you always say, "Okay, have you ever tried something? Did you speak to your doctor?" So all these questions, they have a relevance. The patient is definitely going to be coming up. Like if the patient has spoken to the doctor, he would say, "Yes, I did speak to my doctor. The doctor wants me to speak to the pharmacist." Or there could be a flat answer like, "No, I didn't speak to my doctor," which means that the whole thing is now reliant on you, on the pharmacist. So whatever recommendation the pharmacist has to give in the OTC is something that should be most appropriate, and that can never be done unless you ask appropriate questions from the patient. So then followed by questions like, "Have you tried something? Did you try something for this condition before?" If the patient says yes, then your response should be, "Okay, how did it work for you? How was it?" If he says yes, it did work, did you feel any side effects? Were there any side effects? How long did it take to subside the whole symptoms and all that? Or there could be a straight, "No, I haven't tried anything." It's probably might be more likely because the recommendation is coming from the pharmacist. So all these questions would enable you to get to the point that you will get to the reference by asking all these questions, and there's no harm in writing them all. Like if you're speaking to the patient, you just write it down because they provide you a booklet, and you have to know how to use it most effectively. And it looks a lot professional too. When you are asking a patient and you are taking notes, it gives a very professional look. So keep doing that. In regards, most importantly, because for me in particular, I used to forget things. So when you write things, they probably get you back to, even if you forget, even if you have the habit of forgetfulness, then the written thing will remind you that you probably wrote something which you always can revert back to. So you get to the reference, you ask permission from the patient, and when you return from the reference, you always say, or before going to the reference, before even asking, you say, to help you, like this was something which I rephrased, to give you the best, whatever the name of the patient is, okay, Mrs. Smith or whatever, ABC, to give you the best recommendation, I need to ask you a few questions. So all these questions rephrased, and then before going to the reference and coming from the reference, okay, thank you so very much. So what from my reference, you always say something like that. So from my reference and the details and the symptoms that you've told me, what I think is that you have this. For that, I would recommend you this much and this, based on the reference. And for that, to make the things more appropriate, because in the OTC session, there are certain things, there are certain mnemonics that you need to either develop or remember. So what I personally did was DOSAM, DOSAM. D is for dose, O is for onset. That is very, very important. In the OTC station, it is absolutely imperative that you have to mention the onset. That when is this particular recommendation beginning to work? How long does it take to begin working? Because the patient might feel much more comfortable that this medication is going to be working after this long, and he has to or she has to keep taking that medication. And the next is S. S is the side effect. You always mention those side effects rare. It is always good to mention the rare, the common side effects. 2 or 3 are fine, and you always, whenever you mention about the side effects, there has to be a management of the side effects too. And the fourth one is A. A is the allergy. You have to mention that part, as I mentioned in my previous clip, that since you are using this medication for the first time, if the patient hasn't used it, since you're using this medication for the first time, you may feel shortness of breath, skin, high rashes, or swollen lips, or it may deteriorate. Discontinue the medication and go to the emergency. So this is the allergic part that you address in the OTC session. And the M is extremely important, which is monitoring. Monitoring is extremely important when to see that when the medication has been working, how you keep a track of the fact that this medication has to be taken into account in such a way that you have to speak to your doctor, you have to speak to the pharmacist, and you have to see that whether this medication is working or not, and how well the appropriate symptoms are being looked for. Followed by the same thing, the storage, and the same thing you have to say about the storage. Make sure that you abstain this from children, pets, and all these. And in the end, it's always the follow-up. In the follow-up part, you always mention that is it okay if I call you in a couple of days or weeks, or it depending on whatever medication you are suggesting to the patient. So it's pretty much the same format, but the most important in the OTC station is the onset, I keep emphasizing, and the monitoring. That is the only difference in regards to the prescription which I enlisted earlier. And this is pretty much it, and thank you so very much for your patience.